Do you hate white flour more than you hate soda?
No, soda has to go. You're literally melting your enamel without doing anything. And then you brush your teeth and then that's it. Oops, gone.
If you're going to have a soda, have it with a meal and then give it a rest before you brush your teeth.
Yes, because you have to wait for that pH to go up.
In terms of acid, is drinking orange juice, in terms of acid only, is drinking orange juice as bad as soda?
Yes, but I don't understand why people drink juice, especially kids.
Some kids aren't just cavity prone, and some adults don't just snore. And guess what? Cavities are not a fluoride deficiency. I hope you heard that. Cavities are not a fluoride deficiency. This week on Medical Disruptor, I'm sitting down with Dr. Norma Cortez, a biological airway dentist who discovered 8 cavities in her own 3-year-old after doing everything she was taught was right. And that moment blew the whole script apart. We're talking mouth breathing, airway collapse, tongue posture, grinding, gum disease, root canals, fluoride, and why the mouth often shows systemic dysfunction years before the labs ever do. So if you've been brushing, flossing, doing all the right things and still feeling like something's off, this episode explains what medicine and dentistry keep missing. Welcome to the Medical Disruptor, a place where well-versed humans can ask the hard questions and get evidence-based answers you won't find anywhere else. Every guest on the show must be clinically trained MDs, NPs, PAs, and researchers who want more and expand beyond their conventional education to find deep answers for complex health challenges. And me, I'm Dr. E, the NP with a PhD, and I help smart, well-versed humans go from medically gaslit to medically empowered. Let's get to it. Dr. Norma Cortez, I am so excited to have you here.
I'm so happy to be here. Thank you for having me.
Oh my goodness, of course, it's an honor. So I'm going to catch our audience up and let them know how you're a medical disruptor. You trained at UNC Chapel Hill. You entered dentistry in that typical conventional model kind of way. But today you call yourself a biological airway dentist, which is a path that most dentists don't take. So first, if you could explain that to us, like what the path is, and what was the moment that you realized that whatever you learned in dental school was just not enough?
That's a great question. So, yes, I consider myself a biological dentist. People call it many names, functional, integrative, or holistic sometimes. And I do incorporate airway, and I'll tell you why in a second. It all happened when my back then first son, he was 3, he started snoring. So my path to integrative or biological dentistry started through airway. But then, fast forward, I realized that he was tongue-tied. But not only that, I took him to the dentist or to see me, right? And then I took x-rays because I could. And I found 8 cavities. And it was very eye-opening because back then I was using fluoride. I was doing what I was told and taught. And then, of course, my child gave me the biggest surprise. I call it a blessing in disguise because that's when your mama bear starts and you say, oh, yeah, what's going on? So it started through airway, but it pivoted through cavities. And I started understanding the connections between nutrition, mouth, and overall health. Cavities are totally preventable. So I'm excited to tell everybody the good news.
Okay. I want you to know that I think I told you right before we started that you're the second, well, this wasn't before, it was airway dentist and you're biological, which you'll tell us what the difference is in a moment. But here I am, like doing all this medical stuff. I'm the medical disruptor. You guys are the dental disruptors. And it never, ever occurred to me that my cavities were optional, right? I really believed that it was food. Maybe as a child, I didn't brush my teeth well enough or I ate too much sugar. I still snore like a 500-pound smoker, and I am a thin woman.
Yeah.
And it never occurred to me. So I was like, oh, it's my tonsils, it's my adenoids. Like, never occurred to me of this entire dental thing. And so you're saying like you're this 3-year-old little munchkin with 8 cavities and snoring. Like it didn't add up for you. So what did you do? You said you went for airway and then biological. Like, what's the difference there? Explain that to us.
That's a great question. So yes, it was surprising. My bundle of joy started snoring. And so I started understanding airway dentistry or sleep dentistry.
Okay.
So how I can explain it to patients is airway dentistry checks the relationship between your airway and your breathing and how you grow the face to your overall health. Biological dentist, on top of that, you understand, you try to find the root cause of things and try to get less toxicity in your body. So every biological dentist is an airway dentist normally, right? Because you're thinking root cause of everything. But not every airway dentist is a biological dentist. Some of them still use fluoride and then are okay with mercury or with amalgams. But how I see in your wellness journey, it's okay. You can start one way and then continue to learn, because I forgot the famous person who said, all I know is that I don't know everything, or something like that. So if you're humble enough, you can continue to search whatever fits your philosophy.
Yes. And I think another part of it, if I may, as someone who, I call myself a recovering medical gaslighter, because there was a time when I told people they were fine when their labs were fine. But I think the other part is also not beating yourself up for not knowing it sooner.
Right.
Because it's a natural progression of information, and you look back and you're like, oh my God, how did I do that in the past? And then you only knew what you knew, and there was always good intention. So I think that's important too. So, okay, so after dental school, you go for additional schooling for airway and then additional schooling for biological?
So there's no formal airway specialty or biological specialty. You take extracurricular classes, right? You don't know how much I spend after school, but you have to. You have to. The more you know, the more you need to know. You can unsee things. So I still remember how, oh my gosh, I feel so bad. I will tell moms, grinding, they're going to grow out of it. When I know now, they're going to grow into it. Same with cavities. Oh, they're baby teeth. Well, no, right? There's so many things. Or, oh, you're snoring. Yeah, talk to your physician. And that's it. Like, I'm washing my hands, right? Like pilot. Or the one who, back in the days. So it's very humbling. But you're right. You need to move forward and just continue to do the best you can.
Yeah. And, I want to surface for our audience that with biological dentistry, functional medicine, the clinicians, not only who do this, if you're in this world, are people that not only did we take time, we took money. Like there's no school loans. This is like, you have to be inquisitive enough and willing to put your resources while you're working and practicing and doing all the things. You're like, let me go back to school and learn more. It's unfortunate that it's not part of the curriculum. So everyone has to make this happen. So kudos to you for doing that. So thank you for doing that. So tell us what you mean when you say cavities are optional, preventable. What does that mean?
Well, if you think about, you have to understand how cavities are formed. And the fact they are a chronic disease. They're a preventable disease. I believe the CDC calls it the number one preventable disease, and the reason why most children miss school. So if the traditional version is, okay, you use fluoride, floss and brush, don't eat sugar, right? Which is true, half truth. So those bacteria are Streptococcus. They're Streptococcus mutans, and they're the cousin of the strep throat. So they do eat sugar, but for the bacteria, anything that is simple carbohydrates will be sugar. So a lot of patients say, but I am eating well, but they're getting an organic sourdough white flour bagel. Well, guess what? That's also, right? You're also feeding your bacteria. Other moms or patients will say, I cook everything. Great. Are you mouth breathing? Because that's going to change your microbiome. And another patient will say, yeah, I floss. I don't use fluoride. But you maybe want to do another alternative, which is hydroxyapatite, right? Or is your gut absorbing the way it should be? A lot of the problems in your mouth, it's related to your gut. If you're eating, but you're not absorbing anything, and I know that's around your area of expertise, if you're not absorbing anything, well, guess what? Your teeth are the perfect mines for your body. If your heart needs whatever minerals it needs to pump, which they do, it's going to get it from your teeth or bones. You don't see them though. So
This is amazing.
yeah,
Sorry,
you're
I didn't mean to
fine.
cut you off.
It is very interesting. And so one thing that I can tell people in general is, first of all, it's not your fault. You were not born with this knowledge, right?
Right, right.
Some cultures understand it more if they're more rooted to their culture. So I am Peruvian, so I understand. We, for example, see kitchen as the center of everything, including health. So if you're sick, you go and get a tea. If you're feeling anxious, you get chamomile tea, or you try not to depend on pharmaceuticals. You cook because it's traditionally that's where the family surrounds in the kitchen. You know how to prepare those grains. So another example that I say, well, Peruvians, we know how to cook quinoa, amaranth, but we have to process it. And that knowledge has been passed through generations. I came here and no one processes anything when it comes to, like, no one soaks their grains. That was very interesting.
So true.
So
It's so
they're
true.
eating with the anti-nutrients, with the saponin or whatever the quinoa has. Of course, they're not gonna absorb anything or minimal. And then they're confused because they're eating healthy, but they're not absorbing anything.
Wow. That's so true. You know, it's funny you said that because I remember I'm from Israel, so I remember my grandma used to soak everything, and I'm like, how come no one soaks anything anymore? It never
Yeah.
occurred to me, like, yeah, like I just remember thinking that. Okay, so what you're saying is, and I have more questions, of course, like even for the moms, the patients who are like, I'm doing the right thing, like I'm making sure that little Timmy doesn't eat sugar and we brush their teeth, or I cook everything on my own, like because we don't have the understanding of where cavities really come from and we don't understand our gut microbiome and our food, we could be thinking that we're doing the right thing and it's still not the right thing, which is important because sometimes we're thinking like many of us are like, I'm not the person who eats McDonald's and candy all day long. How could this be happening to me? But there's so much more to it. I have a question about mouth breathing, right? So that your child was snoring. So he was probably a mouth breather. Is that correct?
Yes.
That means there's like a jaw structure issue,
Yes.
right? And so it's a two-part question. So that affects the oral microbiome because all night their mouth is open?
Yes, there is a couple of ways that you can affect it. If you are mouth breathing, you're drying your microbiome, and pathogenic bacteria thrive in that environment, right? Because you can start producing more calculus, and they use that mineral that otherwise would have been for remineralization. They use it for their houses, and they hide, right? And that inflames things. Also, you're also inflaming your tonsils. Now, there is one concept that hopefully I could share is the tongue is so important. The tongue should live at the roof of the mouth, right? And that should drive craniofacial growth in both in 3 directions, forward, sides, and down. It should be big. So baby teeth should be spaced out, so adult teeth come in. So how you relate it with cavities? Well, if your teeth are crooked, of course they're going to trap more plaque or food, and you're going to have more cavities. So craniofacial growth is related to cavities in that way, right?
That's fascinating. So is that where mouth tape is helpful because it helps close the mouth for mouth breathers?
It does help. It's a temporary solution because the most important thing is the tongue. The tongue is the king. The tongue needs to go up. So I can close my mouth, but if my tongue is low, whether because it's tied, there is extra tissue there, or because I just don't know how to put it in the roof of my mouth, then taping helps, but it's still, the tongue can collapse at night, especially if you're laying backwards. So in adult cases, that helps. But the number 1 and 2 sites of obstruction when it comes to sleep apnea for adults is the tongue and the soft palate. So that's why CPAPs are the gold standard because it pushes airway. But then you also can have mandibular advancement devices that move your jaw forward. Sure. However, think of that as metformin for diabetes.
Yes.
How can I get rid of my CPAP or my mandibular advancement device? It's all about the tongue and how it moves. And there is something called myofunctional therapy that can guide you and train you to go wide. It's super easy on children, not easy. It's ideal on children because they're growing. You use that growth to grow their faces. Adults, it's a little bit trickier, but still possible. But think myofunctional therapy as a lifestyle.
That's so interesting. Of course, as you're talking, I'm putting my tongue at the roof of my mouth. And it's interesting to know because I had this conclusion, and like now that we know this about kids and we're helping them restructure while their bones are still forming, here we are as adults discovering this, and like most adults, unless they're like really severely unwell, they're not going to go for surgery to get jaw restructure. But you're saying that there's some hope because they could do some tongue therapy.
Yes. You don't have to do surgery. So in some cases, you have to.
Sure.
But as long as you start doing myofunctional therapy, and maybe do a rapid palatal expander or an expander, or even orthodontics in an expensive way, you can totally help and improve your posture, because that also helps your posture.
Really?
Yes. Yeah, there is
How come?
Well, there is a specialty where chiropractors and dentists have joined together, because this part helps everything. So, if you think about it, when you need to breathe, you move your head forward. That opens up your airway. And if you move your head forward, right, or tilt it up because you need to open that airway, you're tensing different muscles and you're changing your posture. So if you go into a natural position, then your posture also follows.
That's amazing. Oh my goodness. Every day I learn how much everything is connected.
I know.
Because we really, I don't know how we did this as a society. We put mouths like as a separate entity, not covered by insurance. Also hearing, vaginas are very separate from the body. Like everything's so separated, and like things are just so connected. Sorry, I didn't need to bring that in here. But you know what I mean?
Yeah,
like,
it is.
So,
one thing that I notice is, so I'm from Peru, and the majority of the population in my country are indigenous, right?
Okay.
And I have to say, if you're from the Andes, you hardly ever take a pill. So the state of Peru had to create alternative medicine within their system. You have to meet the patient where they are. Just fantastic.
Oh, wow.
I know. I wish they can do it here. And physicians touch the people because they touch the patients. I think it's called auscultation, right? They don't do that here. Yes. So that's interesting here, that they have separated it that much.
Well, sure. And even with the advent of telemedicine, which patients really like, but you're really not touching or hearing the patient, and it's becoming a lost skill, a lost art. That's amazing. So you said also that the mouth is often the first place chronic disease shows up, sometimes years before lab markers. And this is really fascinating. And I want you to explain that because, we spend our time telling our patients in the functional world, like, your labs are kind of late stage. Your labs are like when you're already sick. And, if you're having symptoms, you should believe those symptoms. But you're also saying, not only might have symptoms, but you might have clues in your mouth. Tell us what that means.
Yes. So,
okay, quick break. If this episode is hitting home, just ask yourself this. Are you gaslighting yourself without even realizing it? I made a free guide called Self-Gaslighting Habits to Watch For. So if you're constantly second-guessing yourself in the exam room, this is your starting point. Check out the link in the description. Now let's get back to it.
There are many pathways so we can see. So let's probably separate it on, let's continue with the airway. If your teeth are wearing off, if patients say, my teeth are becoming sensitive, right? Well, they're grinding their teeth. Then you peel the layer, I call it the layer of onions, and then you see why. Oh, you are grinding. Are you mouth breathing? Yes, I am. Interesting. Are you snoring? No, I'm not. I think you are in the beginnings of what's called sleep disorder breathing, right? Without you going into full-blown sleep apnea. Another area would be your gums are inflamed. What's going on? And then you can go from there into what traditionally is, oh, you're having gingivitis, right? But then you peel that layer of root cause. And is it because you haven't brushed and flossed, you haven't seen the dentist? Or is it because you're having nutritional deficiencies? Like in history, it's known that people used to have pellagra or bleeding gums because of nutritional deficiencies, vitamin B, D, especially I think folate and niacin, I believe. But there are deficiencies that you can see. So if it's a little inflamed, we don't just do a cleaning. We also say, maybe you want to run your labs to see if you have any deficiencies. What's going on? Or out of the
Wow.
blue, in 6 months, a patient gets small, tiny, itty bitty cavities that could be reversible. But then you're like, the problem is not the cavities. The problem is why?
Why?
Are you eating? Oh yeah, I am doing more salads. I'm eating healthier. Well, are they cooked? Like, are you doing a lot of oxalates maybe that in your body might not be healthy? You might want to talk to a functional doctor, right? Maybe there's a little bit oxalates, more oxalates than needed, and your body is not doing well with them. That doesn't mean other people cannot eat raw salads all day long. So you peel the
Oh, yeah.
layers of why, and of course, we'll do their cleaning, but you can see pieces of the puzzle before everything starts to unfold.
Okay, what about geographic tongue, which is like, for those who don't know geographic tongue, it's this tongue that has like this kind of outline that almost looks like a map.
Yes.
What does that mean?
So in dentistry, they told me, oh, it's what we call within normal limits. The patient has it. However, this is what I have found. Everybody has fungi and good bacteria and bad bacteria. But when your microbiome is not stable, the fungi starts to increase, especially if you have abused or used too much antibiotics, right? Well,
yes,
I have a tip for those people. If you tongue scrape with a toothpaste or an ozonated oil. I don't know if you know what ozone is. For people who don't know,
you can feel free to tell us.
So for people who don't know, ozone is 3 molecules of oxygen, right? So when there is a lightning storm, you can also make it at the dental office or at the physician's office. But when there's a lightning storm, one of the molecules of oxygen debonds, and that is very unstable, and it goes into a molecule of O2, making it O3. That extra is very unstable, and it binds into bacteria, viruses, you name it. As long as they don't have antioxidants, they will die, making it the perfect healer in a healthier way. So it doesn't do anything with us, but it will kill things. So if you can ozonate water, gas, oils, and you can get them in Amazon too. That's not too hard to find. So you put a little bit of that on your tongue scrape, and then you scrape. You scrape. Wow. Not just the brush, because you're going to be surprised what you find after you scrape your tongue. Give it a couple of months. You're going to see less inflammation on your tongue because you're getting all those pathogens out.
Should we all be scraping our tongues, or is that just for people who have geographic tongues?
Oh, no. You will be surprised what you can find, because you want to prevent things from happening. You don't want to act upon a disease or a problem, right? Should we start?
So we all should run out and get tongue scrapers, and you should do that every day?
I would get a scraper, and you'll be surprised of what you find. Maybe you don't want to do it every day.
Well, I don't want to find.
But you want to do it at least weekly. Yeah.
At least weekly?
Yeah. Why not? It's a good habit. Yes.
Okay. Don't think I'm not immediately going on Amazon and getting one and getting ozonated oil to do that as well. Like immediately. This is great. So we talked about how inflammation in your mouth can show like maybe nutritional issues, but you also speak about how dental inflammation can affect fertility, pregnancy, perimenopause symptoms. What's the connection between your gum health and female hormones? Like, what am I missing?
Great question. So there is a direct relationship, and I believe that is even taught in dental school, between pregnancy and gingivitis. Not even just periodontal disease, but gingivitis. to where those bacteria go through the blood supply on your body, and then they can wreck your hormones. They can wreck everything because it's everywhere in your body. Especially if you're pregnant, they could cause preeclampsia, preterm birth, low birth,
Wow.
yeah, or even
Crazy.
unfortunately death. So there is a case in 2011 in North Carolina that a baby was born still, otherwise healthy baby, pregnancy. They didn't know what happened until they did a dental exam and the mom had periodontal disease. So they found there's two bugs that are really, really bad. One opens up the cells, and the other ones, they say, hey, follow me into the system. P. gingivalis and S. serratum, I think. But P. gingivalis is bad. They found those two in the tummy of the baby. So that tells you
Wow.
that it can cross the placenta. So that was a very sad story because by now it was 2011. We should have eradicated or at least prevent that from happening. It was as simple as doing a deep cleaning, yet that baby had to suffer. So there is a connection with periodontal disease and cardiovascular disease, diabetes, Alzheimer's, of course, hormones, and then baby preeclampsia and all of that.
Let's talk about some of these hot topics that are out there in social media around dental. We're going to talk about, I can't wait to hear your opinion about root canals, mercury, and the amalgams and fluoride. Which one should we talk about first?
Let's do root canals.
Okay, this one really I can't wrap my head around it. So tell us where you stand.
Okay. My sense on root canals are, first of all, you cannot clean the inside of the tooth 100%. That's even taught in dental school, right? Because it's a labyrinthum underneath. So you might miss something. The only way or reason I could say, okay, it's okay to do a root canal is on a growing child, that if they have had that front tooth that we need to take out, normally bone grows with the tooth. So if you remove a tooth, the bone stops growing, but the child continues to grow and it's going to form a huge defect, right?
Okay.
That is going to be almost impossible to restore when the child stops growing. So let's say little Jimmy has a baseball hit on the mouth and he is 8. That tooth is just forming. Well, he's going to grow until he's 21. So to prevent that huge defect, because remember, the bone is going to stop growing. The bone needs that PDL, that membrane around the tooth in the bone to grow. You can do a root canal and keep it. Normally, Jimmy is healthier, right? Until he stops growing, and then you swap it for a ceramic implant, right?
Okay. So let's put that aside. Except for that, no one else should get root canals.
Yeah, ideally, yes. Now, in your wellness journey, you sometimes cannot afford an implant. So I would say it could be a stepping stone.
You're saying 1, don't get a root canal, but 2, if you have one, switch it for an implant. Is that what you're saying?
Ideally, yes. But we have to meet what our patients are, right? I cannot be extra radical in that sense. So if a patient cannot afford an implant, because let's be honest, you can use it as a stepping stone as long as you know pros and cons of your teeth.
Here's my dilemma around this, which maybe you can help me with this. So the idea, I just want to say it back. Let me make sure I understand it. Right. So root canal is basically we're taking out the root of the tooth because it's so, whatever, the cavity is so great, or which we already know we could have prevented. So you're taking it out, and the contention is that, and then you kind of reseal it. And the idea is you're going to reseal and definitely going to have some bacteria in there because it's not possible to get a sterile environment in a living area, right? That's the contention. And the contention is like now you're going to have like potentially an infection. That may not be the type of infection that gives you fever, but it's a type of low-grade infection that can maybe create a chronic disease or some such. But where I struggle is that the alternative solution is to add a completely foreign substance, right? Zirconia, usually, right? A completely foreign substance And how do you know that the body won't react to that? Like, how do you know that that's the lesser of two evils?
That's true. And so we have to see materials in a biocompatible way. But we cannot put every patient into one category, meaning everybody should be okay with ceramics. Because no, there's some patients who, for example, have Lyme disease and everything is going to get them into a flare-up. Those patients cannot afford not even a root canal or a ceramic implant, right?
But what are they supposed to do?
Probably a partial.
What's a
A
partial?
partial is a plate that comes in and out so they can chew. Of course.
Oh my goodness gracious. Oh, partial dentures.
Yes, partial dentures or a bridge.
Okay.
If they have a tooth on the end, you can do a bridge.
To follow that logic of what you're saying, right? Because you're pointing to the sick patient, the Lyme patient, as an example, and you're saying certainly the Lyme patient has a high possibility of reacting to this cubic zirconian or ceramic or whatever. So there is an understanding that these implants can also cause a flare. So if you have someone, generally speaking, the people who are chasing this is why I stopped chasing it for myself. Like I tried to remove amalgam fillings where I could, but I did not undo my root canals in favor of implants because I felt like both are not good options. Because if I'm someone who's chasing health, maybe I'm already dealing with something like one of my patients are already like frailer than the general public. They might react. It's still something foreign. It's a substance. It's not benign. It's not a completely benign option. And you're kind of agreeing with me. We were saying, sure, somebody with Lyme can certainly react. So there's this understanding that you can react to this thing.
Yes. So there's a couple of ways to test if you are compatible with a material. The better known is doing a biocompatibility testing to where they draw blood, and then they can tell you if your body reacts with certain materials, and they actually give you the brand names of the materials that they can use, including implants. So that will be a good way to see if that material will fit you. But I know what you're saying. Nothing, unfortunately, will be like your natural tooth. And when you're in the thick of it, you have to make a solution. My advice is if you're not 100%, then don't do it, right?
Yeah. It was just interesting. Yeah, I'm so glad we surfaced that.
Yeah.
Okay, so root canal, when possible, avoid them. If not, change them as your stance. Where are we with them?
Yeah. Oh, yeah. That's a definitely hard no. Not just because they're ugly. Because interestingly, in the state of North Carolina, you can change amalgams for cosmetic reasons, no questions asked, not ifs or buts.
Wow.
Right?
Wow.
They will probably have a problem if you change it for health reasons. Now, I get it. That's not my scope of practice. I can never promise that a systemic problem will be changed because I'm changing amalgam, nor I will ever make that claim. But it's interesting how they do it. I don't like the mercury. Like, it's common sense sometimes to see that when you drill an amalgam, you're gonna form vapors because we form aerosols, right? And mercury is going to form or unform, I guess, from the amalgam, and you're gonna breathe on it. And mercury, everybody knows it's bad, right?
Yeah.
They force us to put traps on the water so our fish don't get mercury because there is more mercury in the waters, right, in the oceans.
Yeah.
But we're not worried about protecting ourselves when we breathe that. That doesn't make sense, right?
Yeah,
so
of course.
When you, first of all, don't get it. And if you get it because you were in the military, that happens, then you want to remove them the safe way, doing the safe mercury amalgam removal technique.
That's smart.
The SMART.
Right? It's called
That's
SMART.
the most known. I know there is other protocols, but any protocol that will guarantee that you're going to breathe oxygen and you're going to be covered and you're going to have a detox protocol before and after. As simple as charcoal. If you want to go deeper, you want to go to your functional doctor and do those tests. Depending on the state, sometimes the dentist can do those tests, not in North Carolina. Go to the physician, to your functional doctor, and see where your mercury levels are, because you might need a deeper detox before those fillings are removed, but you might not. So
Do you feel like everyone, if they could afford it, should go and get them switched
at least
out?
to know, because that will answer many questions. If you have mercury
Or do the blood
toxicity,
test?
the blood test, or there's a couple of ways to see the hair, the saliva, and the urine. But you
Okay.
will know if your mercuries are high. That will open up, just have a lot of answers as to why you're brain fogged, or you're not detoxing, or you're not doing this or that. That would help you. A good functional dentist or functional physician usually thinks on detox anyways. So that
Yeah.
might be part of the plan. And I know that can be costly. So that might be down the line on the plan, but that would be a good way to do it too.
But I like that. I like that. Go get it measured. Like because there's a million things you can do. Is this where you're going to spend your time and resources? And it has a downside, right? Like if it's not done properly, you can be exposed. And so it's not a purely benign procedure.
Mm-hmm.
And so I like this idea of get tested. And like if your levels are good, maybe this is not the thing you chase right now.
Exactly.
Like that's such solid advice. I love that so much.
I believe in freedom of choice. And even if they don't agree with my point of view, or I won't do what they choose, they have the right to do it at their own space. Like I'm not gonna dismiss a patient because they don't want to remove an amalgam, or they say they want to have a root canal. Like I explain, and I can refer them to the doctor that, in cases I would have done it. So freedom of choice, I think that's the best.
Absolutely.
Yeah, the best protocol.
I agree. I agree with that. Like there's certain things even in my practice, I'm not a big fan of like the GLP-1s for weight loss. And so when patients come on my day, because I do primary care, I will say to them, listen, I don't prescribe it. Here are the reasons why. But my colleague, who I love dearly, on Tuesdays, she does prescribe that, and she could tell you the reasons why she's for it. And then you can make an informed choice. It's not like a no, don't do it.
Mm-hmm.
It's, I'm not comfortable with it as a provider, but someone else is.
Yes.
Get educated and see what resonates for you. I love that so much. It's the best. It's a great way to practice. Okay, let's talk about fluoride. Obviously, that's a hot topic. Tell us what you feel, and then maybe tell us why people are so angry about it.
Apparently, people are angry, and I guess I live in the bubble, but I see it as, okay, evidence-based and common sense. My common sense answer is cavities are not a fluoride deficiency. There is nowhere in your body that you need fluoride.
Hold on. You have to say this one more time. Dr. Norma Cortez, say this one more time, that sentence about fluoride.
Cavities are not a fluoride deficiency.
Cavities are not a fluoride deficiency. Such a clear sentence.
Yeah, I'm sorry. You're fine. Continue. You're fine. It makes sense when you say it. Think about this. And I'll go into the evidence phase, but people or the government does not put antidepressants just to prevent depression in the population, which is getting rampant, right? Why are you adding fluoride into the water just to prevent cavities? That doesn't make sense. Now, fluoride does remineralize teeth if you apply it topically. I still don't recommend it. There's so many other ways. Definitely not on water, because the story, I don't know if you know how fluoride is added to the water. It's the byproduct of fertilizers. That's it's added to the water. It's considered, I think, a toxic load that in the 40s they started adding in the water. Actually, there was a recent lawsuit that the people, I guess, won against the EPA, and it took forever. I believe I have it here. I think it was the National Toxicology Program did a systematic review. I think it was in 2012 or so, and the EPA blocked it from going into the public. Well, they did a lawsuit. Fast forward to the early 2020, it was able to be released to the public. And then I think it was last year, they won. There was another lawsuit to the one, and they said, okay, EPA, you need to search because the evidence is clear that it affects the body systemically, not only in your heart, IQ on children. there's so many bad side effects.
And there's a great switch. You could just switch to a toothpaste with hydroxyapatite. So like, what's
Exactly.
the problem?
Exactly. Now, I
My
have to
goodness.
say, I listened to an influencer, who's actually she's a dentist, saying that hydroxyapatite is not the best. And first of all, that has never happened. I mean, it has helped me and my patients. But the country of Japan uses hydroxyapatite more, and they don't put fluoride in their waters. And they did it because they wanted to study how to help the NASA patients. Not NASA patients, the astronauts.
NASA Asha?
Yeah.
Okay.
And so they use hydroxyapatite, medical grade, of course, in their country. And they're one of the healthiest people I see in the planet.
Wow.
Japan. Yeah.
So while we're on this topic of toxic load, right? Modern dentistry has so much materials, and we're putting in metals and bondings and surgical cements, and they live in the body for decades, right? So
Yes.
so I don't know, what do we do here?
Well, first,
Tell us
I
what to
know,
do.
first, we want to work. I see it in two ways. You have to put the fires. I mean, you have to do the cavity. Unfortunately, watching it is not going to make it disappear. And in
Yeah.
hydroxyapatite, when you have a huge hole close to the pulp, it's not going to.
You got to do
I
something.
know. And I feel bad because a lot of patients say, oh, you're a holistic dentist. Now you can help me. And I was like, I need x-rays first. I need to see.
Right.
And
So
second,
here we go.
you have to do a filling or a crown or something. So we're going to put on the fires and then work on prevention. That will be your best bet so you don't get more cavities. And when someone has to have a cavity or a crown, I highly recommend that exam to where you do your biocompatibility testing. We also have materials that are BPA-free, fluoride-free, gluten-free, especially if you have celiac. Some of those components can react. So there are some brands who advertise gluten-free composite. But you just want to do the best you can. Unfortunately, they are chemicals.
This testing that you're talking about, it really feels like it should be just part of like intake.
Yes. Yes.
Because I remember I recently had something done at a regular dentist. And as she was doing this thing, I definitely felt myself getting short of breath, not from anxiety. Listen, I know anxiety. And I was like, I could tell I was reacting to the chemical. And I was very much dismissed because I think in conventional dentistry, like in conventional medicine, there's like, they think the patients are crazy who are very sensitive to things. But as you're saying this, clearly there's a problem because there's a whole industry that's trying to produce dental chemicals that are not as, reactive, or people shouldn't react to as much, or at least there's an acknowledgement because a test exists.
Yeah.
That's it. So like anyone listening, if you've had a weird reaction dentally, like you're not crazy, and now it's in you forever. So it's really important. And this idea of being able to test earlier, again, like it's very objective, right? It's not like I'm looking into your eyes and figuring it out.
Right.
Like objectively, you're either compatible or not. I love that so much.
Yeah. Now, I think the reason why traditional medicines or physicians dismiss patients because they just don't understand it.
They don't understand.
Because they do see patients who don't react to things, and the few people who come and see them who react, they're puzzled and they're confused. So, however,
and they're not the majority.
Right, they're not the majority. However, they're becoming, whether because they're more sensitive to things or they're understanding. So the less toxicity you get in your body, the more you know your body and the more you understand it. So for example, I cannot pass Bath and Body Works. I'm sorry about that brand. They might sue me. But
no, I'm with you. I can't go in there.
I will get a headache. I will base myself on Bath and Body Works, right? But I can't anymore because I am not doing much chemicals in my body, so I can feel. So probably if I had a feeling, I might be like you. I might feel if I chose the wrong material.
Yeah, absolutely. I can't walk by that store. It's immediate headache. It's crazy. Let's talk about receding gums. I have an area in my mouth, small area of receding gums. And when I was given the option of what to do, I was like, this is barbaric. I cannot believe in 2025, this is the offering. Take a piece of the roof of my mouth, take it off, attach it with stitches, come back. I was like, you know what? I don't think so. You're saying it's not really a local problem. What is happening when we see this?
Okay, so let's talk about putting the fire. So there's an alternative to that, and then we'll go as to how to prevent it, right? There's something called PRF, which is you draw blood and then you centrifuge it, and you create gold liquid that will heal you, right? So you can exactly, and you can make it thick, thin, a membrane or not, and you can add it in, and that you can heal that. I personally don't do it, but I have a couple of colleagues who do it and they swear by it.
Wow.
So you don't have to. That's another way of grafting.
Okay. That's not really grafting though, because the first one sounds really horrible.
Yeah. Well, you still need to do it under. You still need to maybe lay a flap and then do it under and then grow that gingiva. There is a technique that I am not too familiar because I don't do them, but they swear by it when the people who do it.
Okay.
So there's definitely other ways to graft other than cutting your palate. Now, why, right?
Why?
If you think about the weakest part of the tooth is the neck, right? So you can have a graft or an abscess or a fraction because of your bite. If your bite is not stable, right? That tooth can move. It could be because you're grinding, right? Because if you're grinding, think of how you remove a pole or a post. You move it, and that creates the neck opens up. Think of the gums, the gingiva, and the pockets, the famous pockets. They get bigger, right? And sometimes the gum recedes. Not all the time. Sometimes it stays there, but the concept is the same. You have to move it. So if you're grinding, that could be the cause. Now, why are you grinding? You peel the layer. Could be sleep apnea, could be sleep disorder breathing, right? If you're snoring, that might be the cause because there is a relationship. There's plenty of papers that relate sleep apnea or sleep disorder breathing with grinding. Now, it could be that you might need to do some type of ortho to stabilize your mouth, and that could help the grinding. Now, this might be your area of expertise, so that might be a question for you, but a couple of functional doctors have told me that grinding and parasites could be related.
Oh.
So I don't know. It's completely foreign. Now, I am from Peru. I do believe on parasites. Physicians, MDs, will tell you to be parasite in Peru. It's a taboo here. So I don't know where to stand.
I know. In America, it's like we believe no one has parasites. If you talk about parasites, you're crazy. But as soon as you leave the country, the rest of the world has parasites. I mean, it's the weirdest dynamic in this country about parasites. I don't know the correlation between grinding and parasites, but anything's possible. If this is a reaction, if this is inflammation, if this is a neurological response, then I don't have any studies on it, but it just seems back to what you're saying. Sometimes common sense just makes sense. Okay. So just to recap that, and then I have some more questions for you. Recession is something is happening. Oftentimes it's grinding. Something else could be leading to the grinding, but it's not just that one area. And you don't necessarily have to go get your whole mouth all cut up. I'm going to go look up PRF treatment. So now I have a few rapid fire questions for you. One sign in the mouth that tells you that the whole body is inflamed.
That would be gingivitis.
Yes. So if I have gingivitis, my whole body's on fire.
Yes, bleeding. When I probe around a tooth, you should not bleed. And something is going on.
You know what? I love that because I always say, if your skin issues, eczema, psoriasis, it's not really your skin. It's your whole system's on fire. It's just showing up there. So
it's the same lining. If you think about it, the mouth starts at the digestive system starts at the mouth. It doesn't start after dentistry. No, it starts at the mouth.
Yeah. I love that so much. Okay. What's one dental procedure you would never get for yourself?
Amalgams. I just hate it. Can you see it? I hate them.
I have them because when I was little, I didn't grow up in this country. I don't know what was happening in this country at that time, but that was the option. You just did amalgam. What's one daily habit that destroys the oral microbiome, but most people think is healthy?
Mouthwash rinses, especially commercial ones.
Wow.
They are terrible. I think they commit a genocide on bacteria. Remember, you want to have a good microbiome, and those commercial rinses will kill everything. And if they have alcohol, they can even induce some cancers. I think that the company
Listerine
has a lawsuit, whether it's pending or not, but something is going on there.
Yeah. I think it's Listerine.
With alcohol.
Doing that.
Yeah.
Yeah. Okay. What's one material or chemical in dentistry that you believe should be banned?
BPA. Why use BPA? Everywhere. There's so many other materials you can use, or they're actually composites without BPA, and they work. I place them on patients; they're fine. Nothing is falling off. So why use BPA?
Why is BPA? That sounds pretty.
Another
simple.
thing that I could do is fluoride. I don't know. What do you think? What's gonna have more impact? I just thought about BPA.
To ban
the problem is I don't think no one is going to ban fluoride. I know Kennedy's trying, but I don't know how to do it.
No one's going to ban fluoride. And this is one of those things where it's impressive to see how this has become politicized. And if you are not on the side of RFK, you are not listening to the fluoride conversation. And this is one of the things that drives me crazy. I know this is beyond the scope of our podcast, but it drives me crazy that people's health beliefs are shaped by their politics.
Oh, yes.
Like you can still hold on to your non-RFK values, whatever those are, and still understand that fluoride's not good for you. Like you could still stay in your party.
Yeah.
This is the part that gets me, that we've politicized health.
Yeah. It's so sad.
You're right. BPA will probably go before fluoride. What's one change that has the biggest impact on reversing gum disease?
I would say stop eating white flour, not just because of cavities, but white flour has no nutrition whatsoever. And if you think about gum disease could also have nutritional problems, you can clearly not just avoid or help your gums, but your cavities and your whole body. I hate white flour with a passion.
Do you hate white flour more than you hate soda?
Oh, that's a good one. No, soda has to go. Yeah, because that is, you're literally melting your enamel without doing anything. And then you brush your teeth and then that's it. Oops, gone. Enamel gone.
Really?
Yes. Because you have to have, for cavities or for enamel to melt, you have to have a pH of 5.5 or lower. Well, sodas are 2s or 3s or God knows. And if you brush right after on a very acidic environment, then you're taking away that enamel mechanically. Same concept of brightening, right? So you want to raise that pH first.
What's the right? To drink some water after?
Yes, but you have to be careful because some waters also, their pH is low. So I forgot, there was a table I saw, I think it was on one of the social platforms.
Is that why alkaline water is a little better?
Ideally. Now, it's not going to go in the gut. It's not going to do anything, but at least swish your mouth with alkaline water. It will raise that pH and you can brush. Yes.
Okay, that was a really good point, because I was always like, you're going to swallow it and the pH there was like a 2. So what are we doing as alkaline water? But if you can use that for your oral microbiome, okay, now that makes sense. This was always a question in my head. I'm like, why would I drink something?
I know.
That's amazing. But the idea that you brush your teeth after makes it worse. So if you're like if you're going to have a soda, we shouldn't have soda. But if you're going to have a soda, have it with a meal, because I'm imagining like you're chewing.
Yes.
A meal. And then give it a rest. So before you brush your teeth.
Yes, because you have to wait for that pH to go up. Yes, so frequency matters. So if you're going to get a soda, chug it, don't zip it, use a straw. That also goes with carbonated drinks, not just Coke or the common
like seltzer.
Right, because they're acidic. Yeah.
What about like if you're eating an orange?
Well, oranges, yes, that will increase your pH. When it comes to the acidic, yes. Now with the sugar, you have fiber with the whole fruit, so it helps bypass that buffet that you give those bacteria in your mouth.
But I mean, in terms of acid, is drinking orange juice, in terms of acid only, we don't
Right.
need anyone coming for us, is drinking orange juice as bad as soda?
Yes, but I don't understand why people drink juice, especially kids. There is an
Yeah, to just drink
an
the sugar
epidemic of
water.
non-alcoholic fatty liver disease. You probably know more about it. My kids don't drink juice, bless their heart.
What's one belief about teeth that you wish the entire medical system would just retire forever?
Avoid using fluoride. Why? Why risk it? There are so many.
Why risk it?
The thing is, unfortunately, dentistry is very tied to insurances, right?
Yes, medicine too, of
And
course.
so it is a business in a sense. So insurance won't pay, they won't pay anything. So unfortunately, if your dentist is in network, forget about accepting or not insurance, they are going to run more columns to be able to give a proper wage to their people, right? So they're going to work and see more volume if they're in network, and of course if they see the government insurance, because the salaries are the same regardless of what insurance, and they deserve a good salary. So you have to see more volume to pay the bills. That's why it's more like drill, fill, bill, as opposed to they don't pay us for. If I tell patients, oh yes, 30 minutes, this is what you need to eat, yada yada, mouth breathing, they don't pay me for that.
They don't pay. No, nutritional consultation,
right?
You know, in medicine too.
Yet I still need to pay the overhead.
Yes.
So
that is true.
Unfortunately, biological dentists normally don't accept insurances. We do.
Yeah.
But normally, or they're out of network.
Yeah. So this brings us to our last two questions. If dental care were truly healthcare and not about insurance, what would the ideal dental appointment actually include?
Of course, the traditional, I need x-rays because I need to see what's going on. So whatever is going on, plus a nutritional evaluation, plus a saliva testing to test your microbiome, microscope, so a sample of your saliva and see it on the microscope to see how things are going, and a plan to put the fire, plus how you're going to prevent. And that might include referral to a functional doctor because I don't have all the answers. And definitely just the exam, not the cleaning on the first appointment. I know you're busy, but if you really want to know what's going on with your smile, you really need to spend the hour and a half or more to understand. Of course, an airway assessment. I forgot to say that.
So in a first visit, it would be about an hour and a half.
Probably an hour and a half
to know your mouth.
2 hours, yes.
Or 2 hours just to get to know your mouth.
Yes, because if you're doing so many tests, my exams are an hour and a half. And I don't...
Just the exam?
Yes, and I don't do a microscope swab because I don't have a microscope. I wish I can. Because 20 or 30 to 40 minutes are explanation of what I see.
And another hour is exam.
It's the x-rays and yada, 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 yada.
I don't think I've ever had an hour exam. That's amazing.
Yeah.
Okay, let's give our listeners something to take with them. So if someone's listening, they're brushing, they're flossing, but they still have inflammation or maybe autoimmune issues. What's the first biological dental change that you would recommend they make tomorrow?
I would definitely say focus on your nutrition and airway. That will change your life when you understand if you're mouth breathing or not. That has a correlation with your inflammation in your mouth or cavities. And your diet definitely will help you avoid having cavities, and not eating organic Pop-Tarts, unfortunately, help. And I'm saying that because a lot of patients will think organic X, Y, and Z, or dye-free,
organic Oreos,
dye-free X, Y, and Z helps. And it does, but not really.
Dr. Norma Cortez, I can't thank you enough for being here. You're just a wealth of information. How can patients reach you?
They can go to my website, thebiologicalairwaydentist.com, or they can follow me on social media at thebiologicalairwaydentist.
Amazing. Thank you for being here.
Thanks.
Well, that's another episode of the Medical Disruptor, and this is what disruption actually looks like. Not blaming clinicians, not dismissing patients, but exposing the limits of the system and refusing to stop the conversation there. This community exists because too many people were told they were fine when they weren't. Here, you're allowed to ask questions, you're allowed to challenge assumptions, and you don't have to choose between science and skepticism. If you want tools you can actually use, head to medicaldisruptor.com. You can search any topic and find the episode with the information that you need. You'll also find the book, practical PDFs, and my newsletter where we break down what the system does well, where it fails, and how to navigate care without losing your mind. Until then, keep asking questions, keep asking for more, and keep disrupting.